Hello everyone and welcome to tonight's webinar brought to you by Locate, Locum and Community Pharmacy South Yorkshire. We are welcomed here tonight by Vicki Roberts from Community Pharmacy South Yorkshire, and tonight we are going to cover everything you need to know as a locum about pharmacy first. Everything from what it is to what you need to know about it and how you can get prepared for it. So before we kick off, we're going to do a little bit of housekeeping. So tonight's webinar should last in and around 30 to 45 minutes, and we have time dedicated at the end for questions. So feel free to stick around. This webinar is also being recorded and it will be sent to you after. So you don't have to worry about if anything you want to revise at the end, that's completely fine. Any resources that are also mentioned in the webinar will be sent to you post tomorrow, along with Vicki's slides with some of the clickable resources. So without further ado, I will hand you over to Vicki and enjoy the webinar. Feel free to drop any questions in the comments below as they come up to you for the webinar. But here you go. Thank you very much, Vicki.
Sarah, and good evening everybody. As Sarah said, my name's Vicki Roberts. I'm the Chief Officer at Community Pharmacy South Yorkshire, and that's the new name for the local pharmaceutical committee, the LPC. So just wanted to start really by saying it's great to be here with you this evening and share with you an overview of the Pharmacy First service. As Sarah said, we've sort of got up to around 45 minutes, so I'll talk for the first section and then leave plenty of time at the end for some questions. So in terms of what we're going to cover tonight, as Sarah said, I'm going to give you an overview of the Pharmacy First service, and then I'll talk through what preparation for all pharmacists should look like for the Pharmacy First service. And then we'll finish just before Q&A with looking at what this specifically means for locum pharmacists. In terms of the overview, it is quite a detailed service, so I'm going to cover various elements for you this evening, starting with a strategic context and the background of the service, before then moving into the service requirements and the clinical pathways and the patient group directives. And then we'll spend a bit of time looking at the learning and development requirements before going into that preparation for the service and the Q&A. So just starting with sort of a background really to the Pharmacy First service. Community Pharmacy England, which is the new name for the Pharmaceutical Services Negotiating Committee, or PSNC, as I'm sure some of you will know it, has been discussing and negotiating proposals with the Department of Health and Social Care and NHS England for some time now, well over 12 months. And then on the 9th of May last year, DHSC and NHS England published their delivery plan for recovering access to primary care. And a key part of that plan was the commitment to commission the Pharmacy First service, because it's very much felt it's a way to alleviate pressure on other areas of primary care and accident and urgent care and emergency services. So the service allows the treatment of 7 conditions, which is new. I'm sure some of you will be aware that there was a bit of uncertainty around the start date to the service, but it was confirmed last week on Wednesday or Thursday that the start date is actually the 31st of January, which, as I'm sure you're all aware, is tomorrow. So the Pharmacy First service is a new advanced service, which means that pharmacy contractors can choose whether to sign up to it or not. In an update that I had from Community Pharmacy England today, 96% of all contractors have signed up to deliver the service. And I think that is actually a record for a new advanced service. So, you know, it is seen as sort of the biggest game in town at the moment. It's likely, therefore, with 96% of pharmacies signing up to provide the service, that the pharmacies you will be working in have signed up to the service. There are 3 different elements to the service, and 2 of those you'll be familiar with already. They are the existing elements of the Community Pharmacist Consultation Service, which is the urgent supply of repeat meds from NHS 111. And then also the referrals for minor illness consultations, which, as you all know, can be via GP practices in addition to NHS 111 and urgent care. So the new element that we're going to talk about tonight very much focuses around the clinical pathway consultations. So for those of you who have had chance to start thinking about your training and looking at the various documentation that's out there, you'll know that there are 7 conditions, and each of those 7 conditions listed on the slide there have got the age limits associated with them. I guess one of the important things for us as pharmacists to note is that a significant number of those pathways are children are eligible for them, and children aren't sort of an age group that we are necessarily used to dealing with. So maybe think about, as part of your preparation, how you're going to deal with parents, worried parents of ill children. So some things that are worth pointing out about the Pharmacy First service, and this by no way sort of replaces the learning that you'll get from reading the pharmacy specification and the other documents. But pharmacies must provide all 3 elements of the service. So if you work in a pharmacy that has previously provided CPCS service and they want to continue to provide the CPCS service, they have to provide the new common condition service as well. So pharmacies can't just continue to provide CPCS service. One thing that's different about the clinical pathways element is that patients can walk into the pharmacy for that service. CPCS continues to be just referral, so patients can't walk in for a CPCS consultation. That has to be via referral. In terms of the clinical pathway consultations, they can be provided remotely, and that's except for the acute otitis media pathway, because obviously you need to look into a patient's ear to deliver that pathway. When we talk about remote provision for clinical pathways, it has to be via high quality video link, so preferably something like Microsoft Teams. For distance selling pharmacies, and I'm sure some of you on the call tonight work in distance selling pharmacies, they too are able to provide the clinical pathways and therefore sign up to the pharmacy service. But they cannot provide the otitis media pathway, so they would have to signpost to a bricks and mortar pharmacy if they get any inquiries from patients about that pathway. So this slide just sort of covers a very high level overview of the sort of the pathways and the flows. And there's a far more detailed version of this in Annex A of the service specification. But it's just to show you that referral option is there, as is walk-in, but only walk-in for the clinical pathway consultation. You'll also note on the slide that we talk about gateways being met or not met on this slide, and I'll talk to you in a bit more detail about what that gateway actually means in reality as far as the patient flow and the sort of overview of each of those pathways is concerned. I guess the important point to note here is that if a patient presents to the pharmacy themselves, they walk into the pharmacy because they want to speak to a pharmacist, and the gateway point of the pathway isn't met, it means then that the patient has to be dealt with under the self-care essential service. So there's no service payment or fee for providing that service to that patient. If, however, a patient is referred in from a GP practice, for example, and the gateway point isn't met, the patient can continue to be managed using the minor illness pathway, and there is the fee associated with that CPCS for that patient. So some things that I think it's important for you as locum pharmacists to note from the service specification, and like I say, this is not a substitute for reading the service spec, so do take time to read it if you've not read it already, is that consultations must take place in the pharmacist's consultation room. You'll hear me talk a lot about otoscopes tonight, and I make no apologies for that, but be familiar with the otoscope that you are using. It might be that if you work for a range of different pharmacy owners or pharmacy contractors, that each of them have chosen to purchase a different otoscope. I think one thing to be sort of mindful of is if you've got a consultation for an 18-month-old child with a worried parent, the last thing that you want to be doing is trying to find the otoscope in the consultation room because you're not sure where it is, then struggling to turn it on or having to look at the instruction to work out how to use it. So think carefully about otoscope and how you're going to get familiar with either the otoscope that's provided by the pharmacy or whether you're going to choose to buy your own, which is sort of common practice for locum GPs. So just something for you to think about. Be familiar with the SOPs that the pharmacies are using. Again, they are all likely to be slightly different, and be acutely aware of sort of the process for escalation, particularly back to GP practices. There should have been local conversations between the pharmacy that you're working in and the local GP practice, and it's likely to be very much along the escalation routes that are used for CPCS. I've just popped competency and training requirements on there, and we'll come back to that in a little bit more detail in a few slides' time. Also be familiar with the NHS assured clinical IT system that's being used for recording the consultation and for claiming at the end. For those pharmacies that are using Pharm Outcomes, and I'm not here to promote one over another, but there's some brilliant Pharm Outcomes videos available that talk you through the actual process of the pathway. So I would thoroughly recommend those. And just a final note on the end there, that where you're supplying an NHS medicine, if the patient pays a prescription charge, then you must take a prescription charge from the patient for anything supplied under this service. So just looking at the clinical pathways now in a little bit more detail, I guess it's important to sort of say that the clinical pathways have been designed and developed to support the management of common infections by pharmacies, and sort of first and foremost through self-care and safety netting advice, and only if appropriate the supply of a restricted set of medicines that includes antibiotics. In terms of the development of the pathways and the PGDs, an awful lot of effort and work went in by NHS England, working with quite a significant group of stakeholders and experts to ensure that the pathways and the PGDs are robust and fit for purpose. You'll be aware that there are 23 PGDs and one clinical protocol. So a significant amount of reading and understanding to do there. And the protocols and the PGDs and the pathways are all being sort of thoroughly scrutinised at all levels of NHS England, right up to the National Medical Director, Chief Pharmaceutical Officer, and the Clinical Director for Infection Prevention Control and Antimicrobial Resistance. And there is quite a concern about antimicrobial resistance and an increase in antibiotic prescribing. And I guess it's important to say at this stage that there will be an evaluation, an ongoing evaluation of the service, and there will be sort of analysis through using EPAC2 data to find out what is being supplied. So onto the PGDs, as I say, there's 23 of these plus the clinical protocol. In order to support pharmacists and give people more familiarity and an idea of what they covered and sort of the level of detail in them, a draft set of PGDs was published at the start of December. Now, those draft PGDs aren't the final PGDs. The final PGDs were published in January. And it's the final PGDs that you must sign, not the draft versions. Helpfully, NHS England produced a PGD sign-up sheet last week that's available on their main Pharmacy First web page on their website, which means that you can just sign against each of the PGDs on one document rather than having to go through 23 PGDs. In terms of the clinical pathways themselves, for those of you who have had chance to look at the pathways, the sort of brightly coloured boxes shown in this screen grab here will be familiar to you. So they all follow a similar template and walk you through each stage of the pathway. And each of these follows best practice and NICE guidance. You'll see on there the yellow box highlighted with a red border highlighting a gateway point. And on each of the 7 pathways, the gateway point falls at different parts in the pathway. So if we take the otitis media pathway as an example, the gateway point appears quite early in the pathway because it's felt that any sort of use of an otoscope to look into a patient's ear is beyond the realms of what we would normally be expected to do as community pharmacists during a self-care consultation. So that gateway point is quite high up towards the start of the pathway. But if you compare that to the infected insect bite pathway as another example, we all know that quite often, particularly during the summer months, we will see significant numbers of presentations of patients with insect bites, but not all of them are going to be infected. So that gateway point appears much further down in the pathway. In order for a patient to be eligible to receive a complete clinical pathways consultation, that gateway point must be passed. So now just looking at the learning and development requirements, and I don't think anybody would sort of argue with you that there is a significant amount of training, learning and development to do. I guess it's important to say there isn't any mandatory training that needs to be done, and it's down to pharmacists' own professional judgment to decide what they need to do to become competent to deliver the service. I would strongly recommend, if you've not done so already, looking at the self-assessment framework that's been developed by the CPPE, working in conjunction with NHS England. And what that does is it takes you through a sort of step-by-step framework for you to assess your own readiness to deliver the service. And it appears as a set of statements that you rate your readiness against. And you can either rate yourself as competent, development required, or no previous experience. And against each of those statements, CPP have helpfully provided resources that you may wish to consider to help you to become competent. And the idea is that you then use those ratings and any gaps that you have in your knowledge or competence to develop your own action plan. There's also a whole host of other learning and development resources out there, and I think you could feel overwhelmed by the volume of resources that are available to you, which is why I'd really recommend that you go through methodically the self-assessment framework and develop your own action plan. But this slide just covers some of the other learning and development resources and support tools that are available to you. So NHS England have funded an organisation called CliniSkills to provide clinical examination skills, either by e-learning and videos or some face-to-face events. Unfortunately, the current raft of face-to-face events are fully booked, but I understand that there is a waiting list function for those. Community Pharmacy England, on their website, they've got a page dedicated to Pharmacy First, and they've recorded 2 webinars about implementation and the operation of the service, more than the sort of clinical elements of it, but a really good way to get to know the service in a bit more detail. And then thinking about what's happening locally, and I guess I wouldn't be here if I'm not here to sort of promote the role of the LPCs. So LPCs are doing quite a lot of work locally to fill some of the gaps that may exist in the national training offer. So, for example, in South Yorkshire, we have put on additional CPPE ENT training workshops. And if there are any locums out there that are working in South Yorkshire that want to attend an event, we still have spaces on our event on the 10th of March, which is Mothering Sunday. So apologies for that, but there are still a few spaces left in the afternoon. So please look on our CPSY website and contact us. But lots of other LPCs are doing local events. So if you're not signed up to LPC newsletters, it's a great way to find out what is going on locally, in addition to talking to the pharmacy owners and area managers that you work with. And then finally, as I say, I would really, really recommend completing your personal development action plan as a great starting point. In terms of the promotion of the service, there is going to be some national promoting to the public, and that's likely to start mid to late February. So just to give us a bit of time to launch the service and overcome any hiccups before Big Bang. But I'm sure some of you will have seen in national press already that there's been quite a lot made of the Pharmacy First service launching tomorrow. There's quite a lot of work going on locally as well. So LPCs are briefing local medical committees and working with their integrated care board colleagues to raise awareness with GP practices. And there's a whole host of resources available to support in those local briefing sessions. It's likely that we'll see further resources developed as well, both nationally and locally. So keep your eyes peeled for those as well. So in terms of what do all pharmacists really need to do, and particularly focusing on you guys as locum pharmacists, and I've sort of tried to pull together some of the points that I've made so far in this section. So I'm sure some of you, if not most of you, have already made a start on your preparation for the service. But I thought it would be useful to start at the very beginning to make sure that we covered everything. So starting really with downloading and having a good read of the service specification and the clinical pathways. And you might want to download and have the 23 PGDs and the clinical protocols that alongside each of those clinical pathways, so you get a complete picture for each of those 7 pathways. I told you I'd mention it again, but otoscope availability, think about how you're going to manage that, whether you're going to purchase your own or whether you're going to use the pharmacies. And if you're going to use the pharmacies that you're working in, think about how you're going to sort of be ready to use it when a patient walks in potentially for an otitis media consultation, and get your training plan written and start working your way through that. Think about the IT systems that the contractors that you work for are using, if you're familiar with those already. And like I say, if Pharma Outcomes is one of them, then they've got some great videos available to have a look at. Also think about and get an understanding of how the service is going to be operated in the pharmacy that you're working. So it might be that other members of the pharmacy team play an important role, such as monitoring referral systems. It might be that the pharmacy that you are working in receives far more referrals from GP practices, or do they receive more walk-in consultations? It might be that they use an appointment system, so they try and manage the consultations during a quieter period in the pharmacy. And it might be that there's a key contact within the pharmacy that you want to sort of refer to on the days that you're working in that particular pharmacy. It could also be that local conversations have happened between the pharmacy and the local GP practice already, and an agreement has been reached that initially, for the first few weeks at least of the service, that GPs are going to refer for certain pathways. But again, you'll only know that by having that local conversation with the pharmacy that you're working in. As I've said before, get yourself familiar with the pharmacy's SOPs. Understand how the contractor or the pharmacy owner or area manager want you to demonstrate that you've signed up to the PGDs, and do they need any evidence of training. And it's likely to be different for each of the pharmacy employers out there. Again, I've put otoscope on here, so think about otoscope. And finally, sort of think about signing up to LPC newsletters if you've not done so already. and following them on social media, because you can get some great information about what's happening locally in terms of support and training. I've just included a slide here which has got links to some of the various resources that I've mentioned tonight. So I'm not going to go through that in any detail, but it will be included in the slides that Locator Locum send out to you over the next day or so. So just wrapping up before questions, what does it really mean for you? And I guess just starting with coming back to that point I made at the beginning, 96% of contractors, see, it's moved on since I wrote these slides last week, have signed up to deliver the service. So there is going to be an expectation that all pharmacists, including locums, are able to deliver that service. You'll know, those of you that have read the service specification, that there is a contractual obligation to deliver the service over the pharmacy's entire opening hours. And actually being ready to provide the pharmacy first service will set you apart from other locum pharmacists. So, you know, it's likely that pharmacy owners are going to prefer locums that are trained and ready to deliver the service. So it's a great way to sort of secure work for yourself in the sort of weeks and months ahead. Think about if you have got sort of gaps in your training and knowledge, whether if you work for a company regularly, whether you can tap into any resources that they have available for their own pharmacists. And I guess sort of my final point before we wrap up for questions is just to say, really, don't be scared. You'll have dealt with hundreds, if not thousands, of patients with the same conditions previously. And for example, a female with a UTI, you'll know that they'll need a nitrofurantoin prescription as an example. But this service allows you as a pharmacist to complete that episode of care for that patient without the patient being bounced around primary care. So have faith in your own abilities, be aware of your training needs and work to get those satisfied. But you'll have seen all of these patients before, so it's unlikely that you're going to see anything new. And I guess, Sarah, that is me in terms of my slides, so I'll stop sharing now and open up for questions.
Brilliant. Thank you so much, Vicki. And I'm sure everyone has got a much better grasp of the Pharmacy First service already, just off the back of that presentation. It was fantastic. So thank you very much. So I have seen that there's been a good few questions that have already started floating in, but feel free, guys, to keep adding them into this comment section below. Even if we can't get to them live tonight, we can get to them at a stage after the webinar. So one of the first questions I noticed that had come in here is, there's a lot of questions actually, Vicki, in and around the training, but as you mentioned before, the otoscope training, the face-to-face training is fully booked. Is that I can't actually find the comment here right now, but is the video training that is available online sufficient for that to begin with, while the face-to-face service is being ramped up, I suppose?
It's a really good question, Sarah, and I guess it's really sort of important to reiterate that you don't have to attend a face-to-face otoscope training session to develop your competence. Obviously, we've all got different ways of learning, but there's a whole host of videos out there already. That, you know, quite a lot of pharmacists are sort of choosing to practice on each other and on pharmacy team members, and I've even heard of people practicing on their dog to get used to sort of holding a child in a position that you may not be used to. So yeah, I mean, the face-to-face training will tick a lot of boxes for a lot of people. It's not the only way to develop competence, and it might be, you know, if you've got a friendly GP practice, you can pop round and spend some time with a GP or a nurse and sort of do a bit of a session with them. But yeah, I mean, I think there's an acknowledgement nationally that there has been a shortage of national workshops, which is why the LPCs are trying to fill some of those gaps. And it could be that more sessions are put on in the future, but it's a sort of case of waiting to see at the moment.
Perfect. Thank you so much, Vicki. Now we have a question from Kate about the method of recording the consultations. Is it just through Pharma Outcomes, or is there a brand new way to do it?
So each of the, as with the community pharmacist consultation service, pharmacists on the call might have heard of provider pays. So each pharmacy had to sign up to an NHS IT assured clinical system for recording of certain services. So Pharma Outcomes is very popular. If there are any locums on the call that work in London, they'll have heard of Sonar. And there's also Segedim and one other that I cannot remember off the top of my head. So, but each pharmacy must have one of those IT assured clinical systems, and they must record the consultations through that system.
Perfect. Thank you very much, Vicki. And we have a question from Lindsay asking, can you let them know where they can find the single sign-off for the PGDs? I think you'd have mentioned it in their slides.
I'll make sure, Sarah, when I send you anything at the end, that I provide that link directly to that page.
Perfect. Thank you so much. Let me see. I'm still going through the questions. There's so many coming in at the minute. We have some questions that I could potentially field about specific employers. For the example here, I can see Boots. Our advice from our employers can be found on our help centre that is being updated. As with all compliance and competency with each employer, they will work it ever so slightly differently. And again, it is just being in contact with your employer and just asking them what it is they need in advance. For example, I know Boots are asking for signed PGDs, I believe, or the sign sheet. But again, that'll be employer specific. And you can find all guidance on that on help.locum.com for any of the specific employers that work through our website. So I'll look and see. We have a question here about, let me see. Sorry, there's so many questions coming in. It's hard to, it's great to see though. Let me see. Is there any link between this service and PQS?
So no, there isn't. There's a slight link in that if you've delivered the pharmacy quality scheme in the past, then things like antimicrobial resistance, which has been a huge part of PQS for the last few years, and sort of awareness about antimicrobial resistance will help you deliver the service. But no, there isn't any other link. It's separate pots of funding money as well, so it's completely separate.
Brilliant, thank you so much. We have, I see a couple of questions there around locums. Are they going to be essentially, is it required for locums to perform this service if they are working in the store that has signed up for this?
Yeah, I mean, it's a tricky one, and I guess that's sort of down to those local conversations with the owner stroke area manager stroke employer. I saw that PDA had released something today about, you will be aware of your own professional competence, but it's probably a conversation that you will want to have in advance before you start a shift. So if the pharmacy that you're working in, they're aware that you don't feel professionally competent yet to deliver the service, then they can temporarily suspend the service. But again, that will be a local conversation with whoever you're doing your locum shifts for.
Yeah, exactly. It's going back to daily best practice of locuming, having those conversations before you take on your shift, ringing the store beforehand, just to make yourself a wee bit prepared.
Really.
Let me see. People are asking about in terms of the equipment, if they decide to go and buy their own otoscopes. Is there a list of approved ones, or is there particular ones that are recommended at the minute?
There is guidance in the back of the service specification, so that would be where I direct people to have a look.
Brilliant. Thank you so much. And let me see. I saw someone was asking for more information about the training you were talking about in March. That we can provide that in the pack afterwards as well.
Yeah, we can.
Brilliant. I see a couple of people asking about if this session is recorded. This session has been recorded, so that will be emailed to you tomorrow, along with all of the different resources that we have mentioned throughout the evening, and some of the ones that I can see are being questioned later on. I can make sure to pick Vicky's brain to get the information for some of those afterwards tomorrow. We have here, I suppose, more of a practical question, potentially slightly too detailed, but what do we do if the antibiotic of choice is out of stock?
Yeah, now that's a really interesting question. I was on a Community Pharmacy England call yesterday because the Otigo ear drops that are recommended as part of the otitis media pathway, they have been sort of in and out of stock for a while. And the advice from Community Pharmacy England was that we'll just need to sort of manage those situations on a case-by-case basis. So if any pharmacists become aware of that situation, it's important to sort of let both your employers know, and if you can let your LPC know as well, then we can raise that issue nationally. But yeah, it is a concern, because what you don't want to do is then have to end up bouncing the patient back to the GP practice. But because the supply of antibiotics is being made under a patient group direction, there's no option for us as community pharmacists to supply something other than what's in the PGD. Whereas if you're a prescriber, obviously you've got that choice to prescribe something different, but we haven't under the PGD.
Brilliant, thank you very much. And I saw actually quite a good question there about getting access to patient records. For example, if a patient is potentially allergic to something that has been recommended, is there going to be a level of access granted through some of those pathways?
Yeah, that's another really good question. So NHS Digital colleagues who are now part of NHS England, because NHS Digital doesn't exist anymore as a separate organisation, have been working really hard with the 4 community pharmacy suppliers and the 2 GP clinical suppliers, so EMIS and TPP, who supply System 1. And there's a sort of whole roadmap of digital developments that are going to happen over the next period of time. So the first piece of work that they've been looking at, and which is why the service is going live tomorrow, is that each of the 4 pharmacy system suppliers have got a system set up so that you can complete the pathway consultation within their system. So that's a tick, and that's why we are going live tomorrow. The second digital development is around something called GP Connect Update Record. So what that means is in a couple of weeks' time, and we have been assured that it will only be a couple of weeks, once the pharmacist has completed the consultation and clicked complete, then it will automatically send a post-event message into the GP workflow. So rather than something being attached to an NHS email and it having to be emailed manually, and then the GP practice having to open the email and look at the attachment, that will all be electronic. So the GP practice will still initially have to look at what the pharmacy has done before they then click to say, yes, this can go to into the patient's record, but it'll be a lot more streamlined. And then another part of the digital roadmap is looking at what access pharmacies have to more clinical information. So summary care record, which has now got a new name, and I can't remember tonight what it is, but it's something like I can't remember, but it's some national record. So that gives you the access to what you had before, but there is part of the digital roadmap is to look at extending that access, so that pharmacists can look at things like allergy status and more information on the GP clinical record. So that is coming as well.
Brilliant. Thank you very much. I can see Sherry has asked, is this going to be a service by appointment, similar to this flu vaccination or like CPCS, or just a referral on the day?
So it could be any of those things. So for patients that choose to walk into the pharmacy, it might be that in the pharmacy that you're working in, there's already a system that's been set up that particularly says to the patient, thank you, our appointment slots are between these hours. Or it might be that the pharmacy just says, puts a sort of ticket into the workflow in the pharmacy, and the patient is told that they might have to wait 15 or 20 minutes, but they can wait and then see the pharmacist at that point. If patients are referred by GP practices, that does give the pharmacy more of an element of control, because they can contact the patient and arrange a convenient time that works for both the patient and the pharmacy. So if it's quieter between 2 and 3, for example, they can arrange for the consultation to take place during those hours. So it very much depends on the location of the pharmacy, what relationship and arrangements have already been made with local GP practices, and general sort of workflow and shift patterns and all those things. So it will depend on the pharmacy.
Brilliant, thank you. I can also see a couple of comments concerned about the workload that this would potentially add, and sort of managing that and the pressure potentially coming off patients. So do we have any advice or recommendations for that?
Yeah, I mean, that's sort of the $64 million question at the moment, is that nobody knows, because this service hasn't been piloted. So nobody really knows how popular it's going to be. And yes, it is going to add to the workload pressures, undoubtedly. And I guess, some of that is around your employers and the people that you work with developing more efficient systems, and some of it might be around shifting workload. So if there's things that pharmacists have always done in the past but can be done by a different member of the pharmacy team, that might be something that the owner or the area manager is looking at, so that pharmacists have got more time to deliver this service. But yes, it's a very, very real problem, and at the moment we don't know sort of the scale of, it would be brilliant if the service takes off, as well as people hope, but the sort of an unintended consequence of that is the workload pressure that it's going to create on pharmacy teams and pharmacists.
Yes, I know, it's sort of all a waiting game a wee bit, so it is, to begin with.
Yeah.
Well, I do see there is a couple of questions in around the rate for locum pharmacists, which I am happy to answer. As always, the decision between locum rate is between the locum and the pharmacy themselves. We as Locate a Locum have no actual input into the rate that is decided. It is the responsibility of the pharmacy to ensure that they are doing fair pay for fair work. But we do predict that we potentially might see a slight rise in rates as a result of this service. But again, this is going to be down to the employer at the end of the day. Also see another question about the evidence that you need to provide on Locate a Locum for the service. As Vicki sort of had mentioned, there is no catch-all training that we require to be uploaded at the minute. It is again up to the employer themselves what they require. Most of it will be around the PGDs, a lot of which apparently will be getting signed whenever you arrive at store for the first time you're working with that company. Let me see if there is any other sort of questions. I feel like we've covered most of them. I do see that there are some that seem, to be honest, very technical, and I don't think we have enough time to cover it today, as we only have a minute or so left. But I think we can potentially start rounding off in that case if there's no more new questions. And if any other questions come towards the end, continue to fire them down and we will answer them, because we are coming close to time now. But thank you so much, Vicki, for giving up your time today, and thank you to everyone who has joined online. Just another reminder, this has been recorded and it will be emailed out to you tomorrow along with all of the resources. So thank you so much for joining us, and have a lovely rest of the evening.